Here we are in front of the computer console. It's kind of the brains of the operation. Everything runs right here from the console, including emergency stop and patient positioning. So we'll bring up the screen where our new patient is going to be entered in. I've already taken the time to do that while we're setting up. And so we have our patient information entered in here. And basically at the bottom it's going to ask you if it's a new registration or somebody that's been in before. In this case it's a new registration. So we're going to click that. The screen comes up, we check our information, and we're going to register this patient. It pops up over here on our other screen. We're going to select this patient here, and it's now going to ask us what the purpose of this scan is for. We'll just put perio here, and technician, in this case it's Dr. Dan, so we're going to put DD, and we're going to confirm. Now at this point in the process, we're given the option of several scanning modes with the Prexion. We have a wide mode and we have a high definition mode. The wide mode is 8 centimeters by 8 centimeters. The high definition mode closes it down to 5 centimeters by 5 centimeters. We also have the choice of doing either 512 projections or x-rays as it goes around the head, or in the high density mode 1024. And in most all cases, you're probably going to use the wide area with the 512 images. If you have an endo problem, you're going to go with the smaller 5 centimeter screen using either 512 or the 1024 projections. So all we do on this is we click wide area, standard mode, and we go to proceed. So at this point, the program will ask us to initialize the scanner. It's a real quick initialization that makes sure that the x-ray head and tube are all calibrated and ready to go. So it takes about 30 seconds, and then we're going to go in and seat the patient and go ahead and take the CBCT. So right now we're just waiting for that. And in the other room where the scanner is, it's actually spinning around and doing some calibrations while we wait. And on our patient, we'll get him over here in a minute, and we'll put a lead shield. We use a front and back lead shield. Scatter's not real high, but within the ionizing radiation, makes sense to keep it to a minimum dose on any patient you have. So right now it's done with the calibration, and it's asking us to seat the patient. So we're going to open up the door and get our patient seated, and then we'll show you how the scan actually occurs. Vince is ready to have his x-ray taken, so we're going to put a little front and back shield on him and get him as protected as we can. And we're going to complete our seating here. So if you have a seat there, push all the way to the back of the chair. Very good. And what we have is a chin rest that's going to swing around in position. And we're going to try to extend our patient's neck to the fullest there. Tip it forward till you touch right there. I'm going to run this up just a little. Still touching on the front? Okay, so we're still touching. We have a little strap we put around the head just for stability. And basically we keep this down low around the crown of the head. Put a little squeeze on it here. We'll tighten the arm. Make sure it doesn't move, and then we have a locking arm right down here that locks it in place. So now the patient's seated and ready to go. So we'll step back out to the monitor, and we'll show you how we position the patient remotely on the TV monitor itself. The patient is seated, and now we're going to position off of the screen here on the TV. And you'll see up here 2 highlighted areas that actually show the areas of interest where we're going to be doing our scan. So we'll do next here. It always brings up a screen for safety to make sure your patient's seated, everything's locked into place. And right away you'll see up here on the screen a video image event. So pushing these little toggles here, we can now position our patient to the right position here. And it's a little dim on this screen right here, but what we have here is the patient's nose right here. Here's the patient's lips, bottom of the chin right here. And so we'll do a scout view from right here, which will show up here. And this is actually about the position we want the patient right here. So we'll do the scout once again, ensure the safety, press OK. And it'll take a quick scout view, which will show up right here in just a minute. You can see the patient's a little high here, so we're going to drop him down about 1/2 inch so his chin is a little closer to the bottom of the screen. And we'll do another quick scout image just to ensure that they're where we want them. And it should show this perfectly. That's a pretty good shot right there. And we'll go to next here, which will move the head of the X-ray unit around to a sagittal position, and we'll be able to see Vince's face here in the middle, and we'll position him left, right, or center him based on the scan we need here. And you can see his nose is just a little off to the side here, so we'll scoot him over right here. He's pretty dead center. So we'll do a scout here. Once again, a safety screen, and we should get a nice centered image with the scout view. And you can see we've got about the same amount of space on either side. So at this point, we're now ready to take our scan. Our patient's positioned from a sagittal side and a coronal view here, and we're able to take the next step, which will be our actual scan here. And so we're going to push this button that shows what's going on, and what we're going to do is pause for a second here so we can reposition the camera, and we'll show Vince in living color here. So now we're going to actually ask the computer to perform the scan, and we'll ask the patient not to swallow. Hold still, it'll rotate around the head. It's a 19-second scan, and as it goes around, it's taking a full volume, not a slice, but actually it's almost like a photo at each of the 512 positions as it goes around the patient here. And it is just about complete. It's done right now. And at this point, the computer will say to discharge the patient, so we'll click OK, and I'll go in and discharge our patient. And just step out. And that's pretty much it on the scan thing. And now it's about a 35-second wait for the image to process, and we're able to get Vince back to the operatory and begin looking at his images in less than a minute. You can see already we're almost done with the processing here. This is what the image looks like as it's processing. Gives you a panoramic view, an axial, and a coronal view right here. It's almost a 3D view in that case. And so the reconstruction is just finishing up. In the time when it's reconstructing, you really don't want to do anything with the main workstation at all. And if you do halt the thing, you'll lose all the data. So it just takes a couple more seconds here. It's complete. We can click Analyze. It's going to load our data sets here. And in just a couple seconds, it's going to pop up, and we'll see Vince in 3D as well as axials and coronals and sagittal views here. And this is the advantage of having really nice software, because right away these images pop up, and you're able to just go through the image top to bottom. We just got Vince out of there. The chair is probably still warm. So here we go head to toe here. And this is back to front, and on this slice side to side. We're also able to look at the 3D image in any plane. We can change the templates to maximum intensity projection. We're able to go through and give a cursory look very quickly and see what things are look like. We've got little cheat buttons for anterior, posterior, head, foot, right, left. So if you do get lost in space and time here, if you click one of these, you'll be right back to the home base. There's magnifying tools. There's all kinds of features that you're able to use instantly as soon as the scan is done. So that's one reason I like Prexion so much.
Just sit real tall, smaller your back, all the way against the chair. Bring this up to your chin. Okay, rest your chin there for me and your forehead forward. Okay? Put up your ponytail here. Lock in. Okay. Now sit real still for me. I've got a couple settings to set here. settings are complete.